Right. Okay. It seems that Yeri doesn't respond to my WhatsApp, and he didn't also receive my call. So can we start, Joshua?
Okay, Mister, it's okay.
Right. Well, when reporting the patient's body temperature, automatically you have to say your temperature was 38 or your temperature is 38.5 degrees Celsius. As I have already said before, that you can use past tense or present tense. It's all up to you. And there should be another explanation stating that the patient's condition is very well, or probably the patient condition needs to be improved. If it is a bit high, so you can say, it's a bit high, Mrs. Stephen, I will report it to your doctor. Because you are only a nurse, so what you have to do is reporting the result of the checking, and then you will report to the doctor. All right, Joshua, can you read your temperature, please?
Read my what, Mister? I'm
Uh,
sorry.
read, read the result, 37 degrees Celsius, please. Try practicing to read.
Okay, 36 point.
37, this one. Your temperature was, please read it.
I'm sorry, Mister. Share screen-nya nggak ngeliatin PowerPoint-nya.
Oh, can you see the PowerPoint?
I will send you the screenshot.
All right.
Wait a minute, Mister. So it's going to be look like this. I've sent this picture to your WhatsApp, Mister. Can
Right.
you?
Let me see. Oh, I see. So what you are seeing is the first page. The first page of
Yes.
the PowerPoint that will
First
be used
page PowerPoint.
in the meeting. Okay, let me repeat.
Okay.
So it should be this one. Okay, here you go. Can you see it?
Okay.
Okay, please, Joshua, it's your turn to read 37
Your
degrees Celsius.
your temperature was 37 degrees Celsius.
Okay. And 37 degrees Celsius means it is
It is normal.
normal. Yes, it is normal. All right. Next, assessing pulse rates. How do you assess pulse rate? The first way is by palpating peripheral arteries such as radial artery, and then the second is by auscultating the apical pulse using the stethoscope.
Okay.
Right, so remember, this first way is by palpating peripheral arteries such as radial arteries. Okay, palpating means you touch the patient's hand, okay, or wrist watch, okay, this one, wrist arm, okay, and
Yes.
then the
Okay.
second one is by auscultating the apical pulse using the stethoscope.
Okay.
What is the normal pulse based on the age? So we have elderly over 75 years old, 90 beats per minute, and for adults 60 until 100 beats per minute, adolescent 60 until 105 beats per minute, children is divided into two, children 5 until 12 years old, 60 until 120 beats per minute, And for children 1 until 5 years old, 80 until 150 beats per minute. It's quite fast, okay, for children lower than 5 years old. And for the infants or newly born babies, 120 until 150 beats per minute. That's why a baby or a newly born baby is easily shocked because of sudden noise, for example. Okay, so you make a terrible noise, and then the infants or the newly born baby are getting shocked. Okay, surprisingly. All right, here you go, Yeri. Okay. Next.
Sorry, Mister. Sorry.
Okay, Yeri, welcome back.
Sorry.
Okay, that's fine.
Sinyal, Mister.
All right, I know it. Now, how to report the result of pulse assessment or pulse checking? When checking temperature, you have to use degree Celsius or degree Fahrenheit. But for checking pulse, you can use BPM. BPM stands for beats per minute. Okay, so in 1 minute, how many beats of your pulse? For example, 110 beats per minute. This is for adult 40 years old. So you can read your pulse was 110 beats per minute. It's a bit high. I'll report it to your doctor. You can also use present tense. Your pulse is 110 minutes. It's a bit high, and I'll report it to your doctor. Why present tense? Because this is a result. This is a fact. So you can use present tense. Why past tense? Because it already happened in the past. 5 minutes ago, you've already checked, and now you have to report. So if I may suggest, you can use both present tense or simple past tense. Okay, now Yeri, please read this one.
Yes.
80.
Your pulse was 100.
Oh, this one. The second one. The second one.
Oh, 18 blood. Okay. 18 blood pressure. Yeah, Mister.
Not blood pressure, beats per minute, not blood pressure.
But beat per minute. 18 beat per minute.
Your pulse was?
Your pulse was 18 beat per minute. It's normal.
Right. So my suggestion is you have to know the normal range of pulse based on the age category. All right. For example, 110 adult 40 years old. Is it normal or not normal? Oh, this is a bit high. Okay, but for 40 years old with 80 beats per minute, it's normal. So you have to memorize the previous slide. Okay, this one. Okay, so we have age categories from elderly, adults, adolescent, children, and infants. Well, look at this picture and locate the pulse site. There is donut over there.
I'm sorry, Mister.
Here is location or Joshua's location?
That's mine, Mister. I'm sorry.
So donut is everywhere. Yeah. I also donut in front of my house every afternoon. All right, so please have a look. Can you locate the pulse site? So we have 8 sites of checking the pulse. Number 1 is temporal. This is temporal site. So in this location, you can check the patient pulse. All right. Number 2, anyone knows what is the name of number 2?
Laring.
Carotid, Mister. Carotid.
All right. What about Yeri? Do you have another name? The location is
Laring.
near the neck. All right. So we have carotid, right? Very good. And how about number 3? What is the name of the site? Have you learned about this in nursing subjects?
Yes, but I
Yes.
think I've forgotten.
Been long time ago. Yeah?
Yes.
All right. Number 3 is brachial.
No.
Brachial. How about number 4? Number 4 is a location or a site which is commonly used to check pulse site.
So then,
What is this?
bukannya apa ya?
All right. 1, 2, 3. Okay, this is
Radial. Oh yeah.
Number 1, temporal. Number 2, carotid.
Carotid.
Number 3, brachial.
Brachial.
And then number 4, radial. Radial is on your wrist. Okay, on your wrist. How about number 5? What is this? Number 5 is femoral. Yes. And number 6, can you notice what the site in this location is?
No.
You don't know. All right. Number 6 is popliteal. Is it familiar with you?
Some of them is familiar, but
not for this one. Yeah? Not for this
not
one.
For this one.
Right. A very unique name. Okay. How about number 7? This is posterior tibial, and number 8 is dorsalis pedis. Okay, so once again, how many sites? Hello, how many sites?
5, 6, 7, 8. 8.
There are 8
sites.
pulse sites. So not only in the radial site only to check the patient pulse, but we have 8 pulse checking location. Assessing peripheral pulse. I want you to read and complete the steps of assessing peripheral pulse below using the words provided. All right. So we have 5 questions, and in the box we have the choices or the option to best complete the sentence 1 until 5. I will start from Joshua. Joshua, number 1, please.
Frequency of pulse assessment. Check apa ya? Wait a minute, Mister. Check. Or nursing care plan. Nursing care plan apa ya? Take note, Mister, mungkin take note or nursing care plan for the frequency of pulse assessment.
Check note or nursing care plan for frequency of pulse assessment. Okay, how about Yeri? Do you have another option? Yeri, do you have another
Apa
option?
ya? Cek select mungkin select
Really?
check
Select is a verb, so there is no any two verbs. Okay, check and select verb. Okay, you are not allowed to use the two verbs in a row.
check
Okay, so the answer is check medical order.
Okay.
Medical order. Number 2.
procedure
Yes, Yeri.
procedure
Procedure. Joshua.
Perform, Mister.
Joshua, perform. All right, good. Perform hand hygiene. Okay, you have to wash your hands first before checking the patient pulse. Okay, number 3.
Identify.
Identify the patient. So you ask the patient's name. You ask everything about the patients. Number 4, Yeri.
close close yes apa count mungkin close count
Okay, Joshua, do you have another answer?
Close curtains.
Curtains. Okay, what is the meaning of curtains in bahasa Indonesia?
Apa namanya? Korden mungkin, Mister. Apa namanya?
Yes, very good.
untuk
All right. Next, number 4. Still discuss the
Procedure.
Or Joshua, discuss the
Procedure.
procedure. All right. So you have to discuss the procedure with the patients. And how about number 5? Blah blah blah.
On.
Yes.
Put on.
Put on gloves. Okay. What is in bahasa Indonesia?
Pakai.
Yes. You have to put on gloves as appropriate. Okay. How about number 6?
Waduh.
All right, so you cannot see the option. All right, I want you to
Shoot.
all right, to take the picture of the table first on your handphone.
Okay, Mister.
Do it.
Yes.
All right, silakan difoto dulu optionnya. Nanti Mister masuk ke slide berikutnya.
Okay, done, Mister. Finished.
All right, finished.
Yes.
Number 6. Blah blah blah, the appropriate peripheral site based on assessment data.
Note.
Yes.
Sebentar, Mister. Iya, note mungkin, Mister.
Notes. Okay. Select.
Oh iya, Ding.
Kan pilih dulu ya. Pilih
Iya,
dulu
iya.
site atau location peripheral yang sesuai, yang cocok berdasarkan apa? Data assessment-nya. Okay, number 7. Yeri. Move the patient's clothes to
clothing tuh bagus.
Yeri sudah memfoto optionnya tadi, pilihan jawaban.
Belum, Mister.
Oh, belum ya.
Belum.
Silakan difoto dulu nih, Yeri. Yang ini yang di kotakan atas ini dipoto dulu. Ya.
Oh. Ya,
Ya,
udah,
Yeri.
udah,
Sudah?
udah.
Oke.
Udah.
Akan dijawab Yeri nomor 7.
Expose kan, expose.
Expose.
Move the patient clothing to expose only the set cushion.
Chosen. Joshua, do you have another answer?
Sama, Mister. Expose.
Expose. Let's see. Very good. Number 8, Joshua. Your first, second, third.
Compress your first, second, and the third. Oh, place.
Place, yes.
Oke.
Place. Tempatkan.
Oh iya, yang bawahnya baru lightly compress.
Alright, yang bawahnya baru lightly
Compress.
compress the artery. Number 9, Yeri.
And place.
Yes,
Place.
has been taken for number 8. Alright, number 9 is
Calculate.
calculate. Yes, the answer is count.
Count. Okay.
All right. Using a watch with a second hand, count the number
Ya,
of
harusnya.
pulsations. All right,
Nah,
and
itu.
multiply this
Okay.
number by 2 to
To calculate. Harusnya.
calculate the rate
Iya,
for
iya.
1 minute. Okay. Jadi cukup melakukannya dalam waktu 30 detik saja ya. Nanti kan tinggal dikalikan 2. Ya, misalkan selama 30 detik kok cuma ada 25 beats per minute, berarti tinggal dikalikan 2 saja. Ya. Oke. Number 10.
Baru itu note, Mister, terakhir.
Note the rhythm and amplitude of the pulse. Kalian tulis hasilnya. Oke. Alright. Do you have any questions?
No, Mister.
Nah, kan masih ada waktu sampai jam 4:10.
Oke.
Ya. Materinya hari ini sudah, sekarang waktunya mengerjakan tugas. Ya.
Oke, Mister.
Di Skalsa ada tulisan assignment. Ya. Silakan dikerjakan tugasnya sekarang saja. Kenapa? Karena kalau ditunda-tunda nanti nggak dikerjakan, nggak selesai.
Oke, Mister.
Ya.
Oke.
Nah, di sana ada tulisan instruksinya. Ya. Silakan, boleh berpasangan, boleh sendiri-sendiri. Kalau berpasangan berarti mungkin Joshua jadi pasien, Yeri jadi perawat. Atau kalau mau sendiri-sendiri ya berarti harus ada yang jadi pasien siapa, apakah temannya, apakah anggota keluarga yang lain dan sebagainya. Ya, oke. Ya, dan di tugas pertama itu bukan cuma nulis skrip, ya, tapi juga merekamnya dalam bentuk video. Ya,
Oke, Mister.
merekam percakapan kalian seolah-olah sedang memeriksa pulse, memeriksa temperature. Ya, do you understand?
Yes.
Ya. Deadline-nya adalah hari Rabu. Ya, deadline-nya hari Rabu. Kalau nggak salah, lupa Mr. Benny sudah nyeting sampai jam 12 malam hari Rabu. Ya, nanti dikumpulkan di Skalsa juga di sana. Ya, jadi yang dikumpulkan adalah naskahnya, ya, naskah percakapan, tapi cukup tadi temperature sama pulse dan rekaman percakapannya. Ya.
Okay.
Nanti di pertemuan kedua tanggal 25 kalian masuk ke blood pressure sama respiratory rate. Jadi saya sengaja dibikin 2 tugas itu biar nggak kebanyakan. Oke?
Oke, Mister.
Yes. Nanti kalau yang buat videonya kalian upload di YouTube dulu, terus nanti dikopikan linknya nanti dimasukkan ke Skalsa.
Oke.
Ya, sudah pernah belum seperti itu?
Sudah.
Belum sih, Mister. Saya belum.
Belum pernah?
Biasanya buat yang semprot itu, Mister. Semprot online biasanya gitu.
Oh gitu.
Iya.
Nah, jadi bikin video, nanti videonya diupload di YouTube-nya Joshua atau YouTube-nya siapa gitu kan. Nanti copy linknya dimasukkan ke bagian assignment, ada tulisannya assignment. Ya, ada pertanyaan?
Ya.
Oke, Mister.
Nggak ada?
Nggak ada.
Alright, thank you very much. And I will
Yuk.
see you in the second meeting on August 25th. Selamat mengerjakan tugas, ya. Lebih baik sekarang daripada ditunda-tunda lagi. Ya.
Ya, Mister.
Ya, thank you very much. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.